All right. Well, first off, thanks for having us here tonight. We're really excited to be here and share our program, and really thanks for putting this on. I know when I was a medical student, this was an incredible resource for me when I was learning about programs and figuring out where to apply. And so I'm really happy that this is still going on a few years later. But my name's Ryan Anderson. I'm one of the chief residents at TriStar Nashville, and I'm joined by Tanner Kimball, my co-chief, and we're here to tell you about our program. And so we're going to start with some quick facts about our program. I'm going to answer some questions early on. We are a new program, initially accredited in 2023. So we are the inaugural class. We're in our PGY 3 year. We're an advanced program with about 4 residents per class. We are a hospital-based rehab unit for all inpatient rotations, regardless of what hospital you're in, meaning internal medicine co-manages, which is very nice, not having to worry about diabetes or blood pressure in most instances, and really focus on the rehab. Our EMR is eClinicalWorks for outpatient rotations and Meditech for inpatient. Although Meditech is going to be changing to Expanse, which is kind of Meditech 2.0 in the spring, which our understanding is closely resembling Epic. We do allow moonlighting in our PGY 3 year with PD approval. We have PD encouragement. Our program director, Dr. Schmidt, has worked really hard to set up moonlighting opportunities and sites for us. And so that's a very good source of supplemental income and experience. And we are affiliated with the new Thomas Frist College of Medicine at Belmont University. They are in their 2nd year, just like our program. And so we're going to start taking some of their students next year. But we've been meeting with them about ways we can help augment their students' education and how they can help augment our training and education. And so we're really excited to be working closely with them. We are an HCA-sponsored program. HCA is the largest sponsor of GME in the country, sponsoring about 5,000 residents and fellows. We can say that HCA does a very good job supporting our residents in their career endeavors, whether you want to go into fellowship, hospital leadership, even research. HCA will throw a ton of resources and people to meet with you at you. And if you're interested in retrospective research, you have the entire enterprise in terms of your patient population at your disposal. And so whatever idea you may have, you have this massive patient pool. And so that's a very exciting resource and opportunity that we have. If you want to do something, you will have a good study population. And so here's our program leadership. Dr. Schmidt is our program director. Dr. Swenson is our APD. And then Brandy Hambrick is our program administrator. And then here's Tanner and I. We are the chief residents this year. And then here's our entire cohort. And so next year, our current PGY 1s will be PGY 2s, and we will have a full house. And we're very excited to have them joining us. Here's some of our faculty. I'm not going to list all of them, but a few I want to point out. We have a lot of interventional pain trained physiatrists who still practice interventional pain and have specific procedure days in the fluoro suite, but they did not give up their physiatry training. And so they do a ton of general rehab, which is great for 4 of us in my class, our inaugural class, because a lot of us are interested in pain, but we still want to practice a lot of physiatry and really incorporate that. And so, for example, I'm rotating with Dr. Peace. He's interventional pain trained, but we will have patients referred for hand contractures, for spasticity. And so we still do a lot of physiatry management. Additionally, say someone has a concern for a neuropathy, rather than send someone for an EMG, you're doing that in the clinic. And so you have the results at your fingertips because you did that procedure. And so that's a really cool resource that we have that we're with these pain specialists that we rotate with. And a couple more to highlight. We have Dr. Mehta, who is our primary spasticity and outpatient TBI attending. Dr. Bingham, who runs one of the largest EMG clinics in the country. He has multiple locations throughout the state and really throughout the country. And so he has 2 or 3 days in Nashville per week. And so we rotate with him early. And then in our PGY 4, we rotate with Dr. Witt. And so you'll get your hands dirty with EMG early on, and then you'll have a slower rotation where you're really going through the basics and really getting your skills in terms of interpreting and kind of going through some rare pathology during that following month. Dr. Swenson is sports medicine trained, and she's focusing on regenerative medicine. And then Dr. Schmidt is interventional pain and spine. We also rotate with elite orthopedics for MSK and sports medicine, and then Hanger Clinic, which is one of the largest P&O companies in the country for our prosthetics and orthotics rotation. And some of our core training sites for inpatient is Skyline Medical Center, Centennial, Horizon, and Southern Hills, which are all in the Nashville area. And then just a couple to point out. So TriStar Skyline is kind of home base. It's a level 1 trauma center. So we get a lot of our spinal cord, TBI, and major multiple traumas at Skyline. It was also the first comprehensive stroke center in Tennessee. It is a burn and reconstructive center as well. It has about 43 beds in their inpatient rehab unit. And then one of Dr. Schmidt's clinics is adjacent to Skyline. And so he has a fluoroscopy suite with a lumbar trainer, which we've taken great advantage of. He has administrative days on Fridays. And so if you're on a consult service, if you're rotating with him, if you're an outpatient, even if you're on the floors, he may pull you up to his clinic and you're going to practice procedures. And so we're getting really good at practicing our transforaminals and trolaminar epidurals, our medial branch blocks or SI joint injections. So that has been a fantastic resource. And he will either come in early or stay late if you ask him to, and kind of provide you some hands-on training. And we really appreciate it. But our confidence in our procedural skills has grown immensely since he's incorporated that. And then next is TriStar Centennial. So this is HCA's flagship hospital. It's a 741 bed hospital. It is the primary stroke center at HCA. It has our primary simulation center with ultrasound, injection trainers, and mannequins. Our consult service is currently centered at Centennial, but we are going to be expanding it to Skyline. And Centennial is starting an inpatient rehab unit soon, I believe starting in 2027, with a primary focus on inpatient cancer rehab. And then some of our outpatient sites to highlight is Premier Pain and Spine has sites at Nashville, Centennial, and then Brentwood, and then Pain and Spine Consultants is in Brentwood as well. Brentwood is where a lot of our population who's interested in regenerative medicine lives. And so it's nice having kind of a foot in the ground because that's where a lot of our PRP and prolotherapy happens. And then again, Bingham Nerve and Muscle is where we have a lot of our early exposure to EMG. And then Elite Orthopedics has some of our exposure to MSK, sports medicine. And then for our rotation schedule, so we try to get our inpatient requirements out early. So during your PGY2 year, you'll do 9 months at Skyline. You'll have 1 month of hybrid, which is outpatient, mostly with Dr. Schmidt doing interventional pain, but it also varies based on your professional interests. We'll help set you up with an attending in a service that kind of aligns with your goals. And then your inpatient backup. And so if someone's on vacation and someone calls in sick, you may be asked to go down to the floor, but that is pretty seldom. You're generally going to be outpatient. 1 month dedicated to interventional pain, and then 1 month of an outpatient mix where you'll do 1 to 2 days kind of in multiple specialties. So general pain, spasticity, and EMG exposure. During your 3rd year, you're going to exhaust and finish your inpatient requirements. You'll be at Horizon and Southern Hills for those rotations. We do 3 months of consults, 2 months of pain, and then 2 months of that outpatient mix as well. And then lastly, 1 month of hybrid/elective. Hybrid meaning you'll do about a week or 2 of kind of a senior role on the floor. And even during that time, you can round in the morning and then have clinic in the afternoon. And then elective will be based on your professional interest. So if it's pain, you'll go pain. If it's MSK, you'll go MSK. EMG, you'll be rotating on an EMG intensive service. And then lastly, in our PGY4, you're going to do your 2 months of pediatrics, 1 to 2 months of P&O, 1 to 2 months of EMG, and then electives kind of in accordance with your professional interests and where you are at in your procedures, though most of us are expected to finish your procedural requirements by your PGY3 year. HCA does allow away rotations if desired, and so that's something you can offer during our PGY4 year. And then again, if desired and you want to go into inpatient rehab, there will be a rotation, basically how to be an attending, in which you basically run the show and you're attending kind of overseas and kind of provides guidance and tips on kind of how to operate from their role. And next, we're going to talk about our call schedule, and I'm going to hand it off to Tanner.
All right. So as far as our call schedule goes, we do home call and follows a typical structure where maybe do more call PGY2 year, and then as you progress throughout training, you'll do less and less. But averages out to about a weekend per month during PGY2 year, and then you'll rotate kind of the weekday calls. So it's typically set up as like a Monday through Thursday person covering the weekday, and then the weekend call will cover Friday to Sunday. And along with this, like Ryan mentioned earlier, we do have the hospital list co-management. So there's always a hospitalist or nocturnist in-house. So if there's any sort of emergency or anything from a medical standpoint, they can kind of take the point on that. And that helps for, overnight calls, makes it more rehab specific to us. But they still keep us in the loop for, anyone that needs an acute care transfer or any sort of emergencies. As far as our didactics go, so we have protected time every Tuesday and Thursday morning, 7 to 9 a.m. We follow a rotating 12-month curriculum, kind of covering all the core topics throughout PM&R. We do a mix of faculty and resident-led lectures, and we try to incorporate board or SAE prep every month related to whatever topic we're on, and then also let's throw in some journal club or case conference for any interesting cases that we've had. We are kind of building up our ultrasound curriculum. It's something we did last year, and looking forward to continue doing with the help of some of our MSK trained faculty. And then just a lot of procedure training. So we have the lumbar trainer at Skyline, then many different mannequins over at the Sim Center at Centennial that are available for us to use. As far as community engagement, so this is one thing I feel like the opportunities are endless in Nashville, and we're still finding new things. I feel like every other month. So we got involved with some high school sideline coverage last year for one of the high schools here with one of our orthopedic sports medicine trained surgeons at Skyline. Then a couple of us recently just did some sports physicals for Lipscomb University with the help of Elite Orthopedics. And then we volunteered for various events such as the Music City Marathon, some of the 5Ks here in town. And then I know some of us residents have gotten involved in the adaptive sports, particularly climbing or running. And then the Special Olympics are housed here as well. So plenty of opportunities to get involved in the community. And like I said, I'm sure there's more out there that, we'd love to get involved in. And then with the Belmont affiliation, we've had recent meetings with their faculty on ways we can stay involved with the medical students, and then also to help each other out because they'll have a cadaver lab as well. And so we're hoping to, share some resources to both our benefits there. And here's just some pictures of us out there in the community. Like I mentioned, the sideline coverage and the sports physicals, and then us at the marathon and 5Ks over the last year. As far as salary and benefits, I feel like we have a lot of great benefits here at TriStar. We get the 4 weeks PTO, great health benefits with dental and vision. There is a orientation stipend, so basically an extra $1,000 just for going through the few days of orientation. Everyone gets a work phone and laptop that I believe you get to keep upon graduation. And then we get free scrubs, free embroidered lab coats. And then from a financial standpoint, we do get a 3% match on 401k. So if anyone's big into finance, I mean, that's something that I really enjoyed using because, it's basically free money that they're matching every year. And then paid conference travel and a lot of research support. So all of our faculty, they've encouraged us to get involved in research and get involved with being able to attend conferences. A couple of us went to AAP last year where we presented a couple topics, and that was all paid for since we are presenting. And then you also get a stipend for maybe a different conference, even if you're not presenting throughout your 4 years here. So I'm using that in a couple months to go to a conference, even though I'm not presenting, but just something in my specialty of interest. So it's good to, for us to learn more and network a little bit. And then, like we mentioned earlier with the moonlighting, it's just extra experience for us and then more income on top of it if you have the time. And then here's just a map of Nashville. So up on the north side, there's the TriStar Skyline. That's kind of home base on the inpatient rehab side. And then more downtown is where Centennial is at. And so we kind of us residents live kind of all over in East Nashville, some out in Hermitage, which is farther east, some in Germantown, which is right beside downtown. So, we'd be happy to answer questions on where people like to live. And here's just some pictures of us in action, primarily at the hospital. So whether it's grand rounds or didactics or conferences, just a little bit of us getting involved. And then here's just some of us out in the community. So all the different sporting events, and then, Nashville's home to all sorts of different types of music. You have Broadway, which it's famous for, but there's never a dull moment here in Nashville. There's always something to do. I feel like we're doing something almost every other weekend, so that's been great to get out and experience when we have some downtime. And then another big perk, I believe, is our learning environment. So on the far right, that's our resident workrooms. Every resident has a dual monitor for charting. Those desks all convert to standing desk if you want. And then we have a little workout gym pictured there at the bottom. So, if you have a break at the end of the day or before going into work, you can get a quick workout on the Peloton or with the dumbbells there. So that's nice to have right next to our workroom. And then our resident lounge, which is always stocked up with snacks or drinks. And then just kind of going over a few of the points that we just mentioned, being a level 1 trauma, we get a wide variety of pathology. We're a new program, so, we're constantly changing and finding ways to make it better for future residents to come. We're a class of 4. So, 4 residents per class. So we're very tight knit and family friendly, and we come from all different backgrounds. So, and lastly, just being in Nashville, like I said, there's always something to do when you get some downtime. I believe that's all we have. Here's some contact information. Feel free to email either myself or Ryan or our program coordinator, Brandy. We'd be happy to answer any questions you have about the program. Then also you can refer to our website, which has a lot of this information in it, and then our Instagram as well.
You will have 2 minutes remaining.
All right, and then we're available if you guys have any questions. So what new aspects of the program are you most excited about? So we've had a lot of new opportunities come up just even in the past few months, whether it's Lipscomb kind of opening the doors to us, Belmont Athletics kind of mentioning that they were welcome to us coming in for sports coverage as well. Our attendings kind of expanding into the regenerative medicine world. I know we have a couple prospective new attendings that are very close to joining that Dr. Schmidt has been very, very excited about. So we're excited about a lot of the new changes that we've had, but also kind of what's to come. It's kind of some of the advantages of a new program, but also being in Nashville, which is really a city that's kind of starving for physiatry. Tanner, anything to add to that?
No, I think you nailed it. New faces coming in, and like I said, there's always new opportunities. So we're kind of taking everything we can get and really embracing it to, help build a strong foundation for our program. And kind of going off of that, what things do you feel TriStar prepares you for in practice? I think when it's all said and done, like I said, we're the first class, so we're still PGY3. We still have another basically full 2 years left. But I think we'll be very strong from a procedural standpoint. If that's something you're interested in, there's a few of us PGY3s that are, so that's been readily available for us to get involved. And I feel like we get a lot of different pathologies. So while we may not have like a dedicated TBI or spinal cord unit, that's something that we've kind of talked about as we increase our volume, but you still get exposure to all those different conditions. But I think from a procedural standpoint and EMGs, it's pretty strong at this point.
Yeah, I'd say the same. I think pain you're going to be exposed to early and often. So if it's something that you want to go into, we offer really strong training in that field. EMG, you're going to get very early and often exposure. And then an inpatient, you're going to have your bread and butter down. I think Tanner and I, after finishing our PGY 2 years, like we were very, very comfortable managing really any sort of rehab patient, but we were very comfortable running a unit borderline by ourselves if we had to, with attending supervision, of course. And then for stroke, I think we have too many stroke patients to even have a dedicated service right now. Just it would kind of, I think sometimes almost like 20 on a given day. We've had probably like over 20 patients on the unit that were stroked, kind of give or take what's going on in the community. And so we do have very strong stroke rehab as well.
Thank you so much, guys.